Hi everybody, I'm Susan Collini and welcome to this month's Roundtable for Age of Innocence and the Renaissance Center for Plastic Surgery. Well, we've got our team here. We've got a lot to talk about. So I'm going to start, this is my usual, I'm going to start to my far right, your left, and I'm going to let all of you introduce yourselves.
Perfect. I'm Ronnie. As Susan always says, I'm chief cook and bottle washer around here. So, I do a lot of different things, but yeah, we're here. I'm doctor's assistant in the OR office side and going back to school in the fall. So.
And he does IT, he does fix it, he lifts.
He does everything.
He does everything. Thank you, Ronnie.
I'm Derek. I am the director of the Laser Center, and I have been doing lasers and skincare for about 17 years now.
That's all?
Really aging myself. And, anything else that is needed of me around here. We're all a great team.
That's it.
And Susan and I have worked also to get our Collini skincare off the ground, and we've done a lot.
We have done a lot over the course of these years, because
Yes,
you've been here for about 13 now, 12 or 13.
12 years.
And we've really hit some milestones, and
yes,
we're doing really great work. I mean, I'm prejudiced here, but I have to sing kudos to Derek, because our laser center is bar none, and it's all because of Derek and the team. And he leads us all with his expertise. I don't know anybody that knows more about lasers than Derek, and to get the results that he does is incredible. And so when you think that you've had a laser somewhere else and it really doesn't work, maybe it's just operator dependent.
Yes.
So I'd like to think that we've got the solution for a lot of different issues. Anyway, that was an intro, but that's not what we're talking about. So to my left, your right.
I'm Ashley, so I'm one of the estheticians too. I'm also an LPN here in the office, working with Doctor, with Ronnie.
Yep.
I'm kind of all on the different floors here on all three, but I do a little bit here, a little bit there, but I've been here for 8 years now, so
Right.
time flies.
As you can see, Ashley, along with all of us, wear a lot of hats because, we all...
family business.
It's a family business, that's right. And
Speaking of family, hi, I'm Sarah. I'm Susan's daughter-in-law, if you didn't know that. I help manage Age of Innocence and the laser clinic a little bit, and I kind of oversee marketing, inventory, ordering different things.
Another chief cook and bottle washer.
Yes, help out with a lot of different things.
Keeps me on track.
Yes,
Yes.
keep Derek on
And so everybody thinks that the girls are all my children, so I take credit for all of them, including Ashley.
Yeah.
So I'll take
It's a compliment.
there you go. So actually our topic today is something that really concerns everybody, and it is melanoma. And May is Melanoma Month. Actually, the Melanoma Day was Cinco de Mayo. It was May 5th. So we just had the official day, which was this past Monday. And we are doing a lot of things to talk about melanoma and skin cancer awareness here. First of all, I want to do a little bit of education. And I know that all of you can chime in about the ABCs of melanoma, but I think I'm going to throw this at you, Ashley. I know that you're pretty good at regurgitating a little bit of facts. So go ahead. Go have at it, Ash.
So the A stands for asymmetry. So when you want to look at, any lesion that's on your body, if you think it's suspicious, if it just popped up, maybe it's been there for years, you always want to look at the asymmetry of it. So if it's, one side it looks round, the other side it's more square, it just looks a little off, that's one thing to look at. B stands for border. So you want to look around the outside of the lesion too. If it has a rigid border, that could be an indicator too. C is circumference, so you want to look at the circumference of the lesion.
And I think that the
color.
circumference is usually bigger than like an eraser tip on a
Yeah.
pencil is
Mhm.
when we start getting concerned.
And color.
Yeah,
Color.
the color
Color.
too. So if you see something that's really dark, black, that's a good indicator too. And then D is the diameter. So you want to look at the diameter of it as well. And then, you
We're
sort of...
talking about 6 millimeters, just that's what Mr. Google tells us.
Yep.
I always like to check Mr. Google for stats.
Mhm.
And then one more.
And then there's the E's.
Evolution.
Evolution.
Right.
Changes.
So
Look for
that's
changes.
the changes.
Mhm.
That's the change in the lesion. And our rule of thumb is if anything looks strange or you're really not sure, it doesn't hurt to get it checked.
That's exactly I always say that to customers because you see your own skin, you see all the spots on you. If it doesn't look like the rest of them, there's a good chance that it's something.
And if something is irritated and bleeding, sometimes people come in and they actually think something is a pimple, or they've been scratching it and it's bleeding for a few months. That really could be a big indicator that you've got an underlying issue with that particular lesion.
And something along the lines of that as well is, you know, people get something on their face and they'll be poking and prodding at it and everything, and then, you know, if it's a cyst, sometimes people will actually pop those and they'll end up popping under the skin, and it actually makes the cyst worse and, you know, causes us more complications down the line. So if you see something maybe on your face and you're worried about it and it's not going away, don't go poking
Come
and
here
prodding.
first.
Come here first. Let us assess, and then we could probably.
We tend not to poke on our body, but we poke on our faces. I know.
Yes.
Do not
I've been a
up a
poker
needle
in
and
my
poke the
day.
incision.
That's right.
Yes.
But you never know. Sometimes the most benign looking thing that you might just think is a cyst or a little pimple or whatever could be an underlying basal cell.
Yep.
It could be a squamous cell. Right. There are different levels of skin cancer, different diagnoses, and
But melanoma is the one that will take your life.
Yeah.
Yeah.
That's
Very
the
good.
serious one.
right. So, does anybody, Ryan, do you have any more input? Because you're on the clinical side too.
You know, just like I was saying, the thing we see a lot is people popping things and they shouldn't be popped necessarily, and then they get infected. Also, you know, different areas of the body, when you're looking at something, you may not think it is a problem, and people come in and we end up doing an excision and it's a melanoma or something like that, and it can lead you down a path that you weren't expecting. So again, just going back to having it checked out and having it looked at is important.
And it can be a really scary thing. I can give you a little tidbit. First of all, my mother-in-law and my husband's family is all Italian. They're dark skinned, and people with dark skin, because they seem to be a little bit more durable in the sun, think, oh, I don't need sunscreens.
Yes.
I'm, you know, it's not a big deal.
Very common.
My mother-in-law had a melanoma, and you know, we were able to catch it early enough. My husband's had a few scares that with the possibility, and knock on wood, everything turned out to be okay. But these are things that you want to look for, you know, any dark lesion, and actually the classic melanoma sign is when it looks like a fried egg. So you have a discoloration in the center of the lesion, and that is a classic sign, but don't take it for granted. We've seen some strange
they look like
things.
red little veins.
Right.
Sometimes they're completely skin colored.
Right.
Anything that just is unusual.
Right, and the thing of it is, all of us are used to seeing things. So sometimes even in the esthetician arena, the staff is so used to, you know, looking at people's skin and everything. And I know Derek.
I've found a lot of cancers.
I mean, honestly, I have a lump on my neck, and Derek found it doing a facial. So I hate to say it, it's a benign one. So we're all good with that. But you know, you'd be surprised what things pop up, and I didn't notice it. And you know, and I'm wearing jewelry and clothes, and I didn't notice it. So it's
when
something
you're
to be
protecting yourself from the sun, don't forget your scalp, and don't forget your fingernails and your toenails. Those are places that a lot of people don't even know that it's a place that you can get it. Anywhere that the sun could cause this radiating damage, it can change the cells and really cause you a problem.
And it, you know, it's great, just get them out, you know, and early prevention is key. That we can't stress that enough. Even a young person in their 20s, we've seen some young people that have had cancer diagnoses in their 20s, and a lot of that has to do with tanning beds and other, you know, poor behaviors that we all take a part of, being in the sun. And sunscreens are very important, and we're going to go through that in a minute. But if you feel that you're okay, we've just scared you, and you're looking at your spots, you're looking at your hands, and you know, sometimes you do get those sun freckles, and we do get just a normal brown spots that are really nothing, but you're really not sure. This entire month of May, we are doing free cancer screening. So if you don't have insurance, or you do have insurance, or you're not sure, you can come talk to us, but you do need an appointment, so please call the office, and you can make an appointment with us. Our phone number is 570-674-6525. and you can get an appointment, free screening, and if you do have or need something removed, we do bill your insurance for that at that time, or we have that discussion with you if
And
you need
it's
something more
something
than
we could get taken care of rather quickly. You know, our schedule is, you know, we make it happen. So
Right.
And to
That's
add
the
in,
difference.
because I'm the cosmetic guy, you're also getting a plastic surgeon that's going to give you a more cosmetic appearance when
Right.
they're taking care of the lesion itself. So if it's on the face or your kid's face or somewhere,
Mhm.
Dr. C is really gonna do a great job
Right.
to make sure it looks good as well.
Yes.
And so we're always concerned about that. And of course, we all have our lasers that can actually improve incisions and different things like that. So we do have a team approach at taking care of this.
Yes.
So anything else on skin cancers? So that was the deep part. We're gonna get into sunscreens, but that goes into just summer in general. But we can't forget something this Sunday, May the 11th, is Mother's
Mother's Day, yes.
And so we're celebrating all the mothers, and my daughter-in-law Sarah, she's mom, and so we've got 2 little ones at home with Sarah, and I've got another 2 at home. So it's great. We're gonna have a big group.
Is that what you're doing?
Yeah, we're gonna have a big group. We're heading.
That'll be a lot of fun.
Yeah.
Yeah. How about you guys? And what we have to tell you that it's Ronnie's birthday
Yes.
on Mother's
Yeah,
Day
wow.
too. So it's a double
It
whammy.
is a double. It's always busy that day.
So you have to do you take second fiddle, or do you just
Me and my mom
Make
just
it both.
share the excitement.
Yeah.
We love it. It's
Share the
all
day.
good. Yeah. No. I always wait for it to fall on Mother's Day because it obviously changes every year, but this one always is a little extra special.
Yeah.
Yeah.
Ronnie's mom's great. We
Yeah.
love her.
Yes.
We have obviously specials that we have for Mother's Day. So I'm gonna let Sarah take this here, and
Yes.
we have lots of different things that we're doing.
We have a bunch of different things that kind of are, in tie with Mother's Day, but also just for the month of May. So right now we have our product specials, and these are also posted on the Facebook page and Instagram page if you want to reference them again. We have, if you purchase $100 worth of our Collini MD skincare products, you can get one of our green tea hand creams, which is amazing, for free. And then another fun gift is if you spend $100 on any skincare, you get a facial roller and gua sha set.
Which is really nice.
Yeah.
that's
Help with
really-
lymphatic
That's a
drainage
really-
and keeping the jawline tight.
That's really great.
So, if you're interested in purchasing any skincare, especially Collini MD, we got some good specials. And then as
We do
far
have
as
our own skincare line.
we do. And then our service specials right now, we have the microdermabrasion facial with one of our estheticians, Celine. We have that on special for $100. So you get
That's great.
savings of $25. And Celine's great. So
Yes, she is.
if you want to book a facial, that's a good time to do it. And then Derek, if you want to chime in on this, we have our clear silk laser, which is good for the summertime.
So Clear Silk is one of our favorites here. We've actually done a video using Sarah, and then I do them on Susan as her maintenance. It's a maintenance laser, and it's a wonderful laser that goes after all things, which is great with no downtime. So it
Age.
helps with redness. It helps to gently warm and build collagen into the skin without, and when we say no downtime, this literally has no downtime. I know there's a lot of lasers that say that. It doesn't actually create a wound in the skin, it just excites the cells. And when you're getting it done, you just feel this gentle warmth. But it is a true YAG laser, so you are getting real collagen building, and it's something that can be done regularly to help the collagen build in the skin and to help keep things tight in the skin clear.
It
one of our
really
favorite
is mild
treatments.
because I'm at the point where I am maintenance, but I like to keep up with it, and I don't need anything really aggressive. And this laser you can get it done and you look great.
You look great after.
Yeah.
I mean, you do. You just look great. Actually, I would even tie that laser in for an event.
Yeah.
You could really have this for a special event and feel that you look great because it just, puffs up the skin just enough that any underlying little crack just pops.
Yep.
Yeah.
goes
It
away.
excites all the
Yeah.
collagen in the
So
skin.
when you think I look better than usual, it's because you did a clear silk on me within hours before.
Yeah,
So
that's
Yeah.
an easy. You
And
can get
I'm
that
a-
on your lunchtime.
I'm a baby when it comes to treatments, so,
Me
but I
too.
can
Yeah.
handle it.
No
and
numbing, no pain,
No problem.
no anything. It's
It's
a
just
really
nice
Yes.
and warming. That's
It
how I
is.
thought
It
it
is.
was. It was
It
so
actually
nice.
is a great laser.
Mhm.
So come check that out because I think
and it
that's
could be
really-
done monthly. That could
Yeah,
be done.
that's
as
my
a-
maintenance program. Once
Yeah.
a month, I chime in for there. We're actually working on. Stay tuned, because we're testing it. We're seeing what the great long-term results are. That we want to create a package for a year-long plan so that you can keep into
Keep
a
up.
maintenance and
Yeah.
do something a little bit more regularly and make sure that you stay on track. Because sometimes we all get busy in life, but once you get a package and you're all scheduled, you kind of
Right.
stay
Stick
on
to it.
track and keep the maintenance going, which is really cool.
Absolutely.
Anything else on the laser
Yeah.
center?
Oh, I don't think I said. So that right now is 500.
Which is a great price.
Right, because normally it's what, $650?
$750.
750.
Oh, it's
yeah.
normally $750, so it's really great, 500. So,
Yep.
so that's a really nice thing if you want to give it your mom, your dad, not your dad. Sorry, it's Mother's Day.
You can-
Oh, I guess it could be a day.
Yeah.
Well, I take that back.
Yeah,
Your
whatever.
dad, there
Right?
you go.
No, we'll
That's
just,
it.
we'll just give it to the moms.
that-
Let's
yeah,
leave
yeah.
the dads out of it.
Yeah, they gotta
Yeah,
come.
they've
get
got
enough.
their own day. They've got their own
This
day.
is for the mom.
That's right. They've got their own day. So, but if your niece, your sister, your aunt, whatever, any mother, it's a great little gift.
And if you're someone who's like Sarah said, if you're someone who's hesitant because everyone Googles, and if you
Right.
hear laser, you think
Google.
of all this downtime. So if you're someone
Yeah.
who's really afraid of a laser but wants that introduction into seeing what they're capable of, Clear Silk's a great introduction because it doesn't hurt. You don't have to numb. It's not one of the scary ones, and it gets
You-
you really
you
nice results.
You can get, good long-term results, but you do have to keep up with it. It's
For
not like
sure.
a one and done kind of
No.
laser.
No.
If
It's
you
not
want a
like a
one and done
CO2.
laser, you gotta look a
CO2.
little bit
Yeah.
rough for a good
Yeah.
week or two.
Oh, yeah.
Gotta
And
break
uh,
eggs to make cake.
We
that's
got
right.
it. We can do it.
That's right.
We gotta be prepared for that.
That's right.
But sometimes, and also it's great for the young mothers who aren't really trying to do anything corrective. There's moms in their early 20s, mid 20s, and they're not looking for this overhaul of their skin. So this is something that's great because it just works with what they have and it excites the collagen in your skin. If you have any breakouts or rosacea, it's really wonderful for rosacea because it actually goes after redness and red veins in the skin. So with maintenance, you'll see a reduction in all those things.
It's a great laser for summer as well.
Great laser for
Because
summer.
some of the lasers are a little bit too aggressive
Yes.
if you have any sun exposure. That being said, I'm gonna let all of you talk about sunscreen, so you're all pretty experts about that.
So we, as we've said many times, it's been like how many years that we've been working on Collini MD? 8?
8. 'cause it's when
8 or 9
yeah,
years.
It's just, 8 years.
So,
So Collini MD is 8 years old.
We have, and our
Baby.
products are all made in the United States by a pharmaceutical company that does no animal testing. They use no parabens. They use no artificial dyes, colors, you name it. They're gluten-free. They're cruelty-free. And that was really important to us when looking into these product lines, and we wanted something that was also American-made. With that being said, it is a pharmaceutical company. They also own Proactive. So they have the ability to pretty much create us whatever we want. And when formulating the sunscreens, we wanted something that we could marry with post-procedure because we do so many procedures in this office. And a lot of the sunscreens that you might buy from the store are chemical laden, there's parabens in them, and
All bad
chemical
things.
sunscreens, and they find that parabens actually hurt collagen growth because they kill healthy bacteria in the skin. So we make sure that our products have none of those things. The other thing that is very important about our product line is that we use a lot of pure zinc in all of our products, which is a physical sunscreen, which just blocks the sun rays. And when you use a very cheap, I should say, bad sunscreen, they use chemicals that radiate energy on the skin instead of just blocking. And what that does is causes acne, it causes clogged pores. People get those little red dots all over because that energy is bothering their skin. So when we formulated our sunscreens, it was all about post-procedure. So when we do something post-procedure, it's also good for your daily use because it's gentle enough to even use on a small child. They're all packed with green tea polyphenols, which is another thing to counteract the irritation of the sun. They have CoQ10, vitamin C, vitamin E.
So you're getting therapy
you're
on
getting
top of
therapy.
sunscreen, which is
Yeah.
great.
And we also have different variations of these formulas that are really luxurious. We have a scar gel that we actually use as one of our most common, just because it's in this really great silicone base. I love it for my daily use.
A little tip, that is my primer
It's
under
your
makeup.
go-to? Yep,
Yeah,
'cause
it's
there's a little
a primer.
silicone
There's
in
a
it.
little slick to it, and it's great. I've got great sunscreen. I've got some good,
And a good
treatment in it,
foundation for
and a
your
great
makeup.
foundation for makeup. It's really wonderful, and it's really great for the skin.
And then we have our tinted sunscreen, which is a color matching tint. There's one that has a little bit of oil absorption, and then one that's also more of a sheer, a sheer and a matte. And then one of our favorites, this has been a huge one for us, is we have a little bottle of pure zinc that we sell. And what you can do is take that 20% microionized zinc, it's just zinc, there's nothing else in it, which is extremely healing for the skin. We use zinc to cure ourselves. You can add that to a moisturizer to kind of make whatever moisturizer you purchase sunscreen as well. We don't sell our moisturizers with sunscreen. You want to be able to separate those two things.
Right.
You want to wear sunscreen when it's necessary, when you're exposed and when you're out in the sun. We don't like to put it in with our product. It's not just
I do wear
another product.
sunscreen every day. It's
Yeah.
part of my
Yes,
repertoire.
and it
but-
should be part of the
but not mixing
but not
it.
nighttime. You know,
Right.
like
Yeah.
if you have a
Right.
good cream that you purchase, you don't want that to have sunscreen in it at night. So again,
Oh, I see where you're. I
yeah,
see
you
what you're
want
saying.
just to have a separate moisturizer. So all medical grade sunscreens, physical sunscreens, safe on all skin types, and they are also broad spectrum, which they cover UVA and UVB radiation, and that is something that is very important when you're trying to get protected from the sun. So we have great
And this
products.
is hopefully this is the beginning of summer. Look at it, sun
Yeah.
shining out
It's
there.
gorgeous.
We came upstairs because when we're in the laser sun, we're a little bit like dungeon-esque a little bit because it's so dark and it's just so nice down
calming.
there.
It's
It's
cozy.
calming.
Yeah.
But when you come back up here, you're bright in the sunshine and you're ready to start the day and do what you have to do. But I don't know. I think we've been talking a lot. Anybody have anything else to add?
When it comes to also prevention of the sun, I tell people all the time, a lot of people are confused when to use their vitamin C products. So vitamin C's prevent oxidative damage, and they also prevent, there's things called tyranase inhibitors. They're preventing you from grouping those brown spots back again. It's actually on a cellular level antioxidant to the skin. So if you really want to take your sun care to the next step and you want it on a cellular level, you would layer one of our vitamin C's underneath that sunscreen to give you a full cellular protection plus topical protection.
So I think another analogy that I used to use with patients when we talk about antioxidants, because people always hear that buzzword, but what does that really mean to the skin? Because when we start using an antioxidant, or we start using we start using sun creams, we don't know do we really see a difference? I feel really hydrated, but am I doing anything structural? Well, what an antioxidant does is, I'm sure you've seen how the sun and the weather can affect metal on the outside. So this is the best analogy I can use. And it rusts. It's out there. Well, the reason it rusts is because there are free radicals in the air, which if you go back to your chemistry and you go back to your atom and you've got electrons, neutrons, protons,
Oh yeah.
you've got they're all supposed to match up, but when you have one little free guy out there that didn't get a mate,
Stealing all the good things.
that's it. He's out there
greedy one.
wreaking
Wreaking
havoc
havoc.
on anything. And
it does damage any cell that it touches. That's
Right.
kind of what they do.
And so that's what an antioxidant does. It does do that. So you are protecting your skin, maybe not seeing immediate results, but you've done something, over the top, but you will
It is on
eventually
a
see
cellular level.
Yes,
Very
it
much
definitely
helping
is.
your
And so
skin.
that's when you have to believe your skincare expert or whatever, or you know enough about chemistry and biology that you can read the material for yourself. But sometimes they get complicated. So
They do.
and I think, is that a wrap?
Well, and then at the end of the
He
season,
can keep going.
at
We're very
the end of the
sorry.
season, when you get all your sun damage, because I know some of you are still gonna do it, we have BBL. I can get rid of all of it right at the end of the season.
That's
So
it.
we'll
It's
discuss
wonderful.
that.
Back
We'll
to being
discuss
there.
that
Well,
in
except for
August.
that, yeah, that's September maybe.
In September.
Yeah, because we're still all, everybody's still enjoying that sun.
And that one's
But as you go out,
Prevention.
Yeah.
think about prevention, and if you like to have that tan color, you can easily get instant tanner cream. What do you call it?
It's to
Self-tanner.
give you a
Yeah,
little
self-tanner.
Self-tanner.
end you with a little statistic. 70% of external aging is from the sun. 70%.
Right. If you look in the book, in the plastic surgery books, they show you people, there are certain populations that are in sun and certain populations that are not.
That is a huge
So when
difference.
we go to those populations, like if we go into the Dakotas or whatever, and I'm not trying to brag on a group, but if
More
you've
northern
got
latitudes.
if you've got somebody that's been out in the sun all the time, their skin
They're
looks
weathered.
like leather, and then you look
Oxidized.
at a monk
Oxidized.
or somebody that's been sequestered inside. You could see a 70 or 80-year-old, and their skin
Beautiful
looks like
skin.
a baby. It's amazing on that. You can see that in the books.
The sun is a big radioactive bomb.
It is.
Basically,
It's all it's doing.
coming at you. So you got to protect your skin for
That's
sure.
That's it.
I
I'm
think
af-
that's it.
I'm afraid to
I'm
say
done.
it,
I
Brad.
promise.
All right, everybody. I think that's it. We've spoken enough, and we've lectured enough today. So I hope you enjoyed our round table, and we will be back in June, the first Wednesday of the month. I can't believe it. Stay tuned, because we haven't really decided what we're going to talk about yet. So we kind of work at it as a team, and then Sarah will put it out there in our social media and let you know if the topic is for you.
And if you want